Good morning, good afternoon, good evening, everyone. Welcome to today's webinar, Nurse Policy Leaders in Primary and Preventative Healthcare, hosted by the International Council of Nurses. My name is Hoyshan Fokilade, Senior Policy Advisor in the Nursing and Health Policy team at ICN, and I'm delighted to be your moderator for the session. We are excited to welcome such a diverse group of attendees from around the world. I see the number is increasing. We have over close to 200 of participants joining at the moment. And this webinar is designed to enhance understanding and emphasize the critical importance of primary healthcare, particularly the vital role that nurses play as frontline providers, advocates, as leader in delivering equitable and accessible care. Whether you're a nursing student, a practicing nurse, or a global nursing leader, this session aims to inspire and support your contribution to strengthening primary healthcare system worldwide. Today, we have the privilege of hearing from our expert speakers who will provide valuable insight into several critical aspects of primary healthcare. They will discuss the evolution and growing significance of primary healthcare on the global health agenda, highlights key takeaways from ICN's latest primary healthcare reports, explore the emergence and contributions of advanced practice nurses, and address essential topics such as patient safety and rehabilitation within primary healthcare settings. Before the speakers start their presentation, they will also briefly talk about how they initially got involved in policy work and give you advice for early career nurses on taking their first step in policy engagement. So before we dive in, let me go over some housekeeping rules. During the webinar, for comments and greetings, please use the chat. For questions to the panelists, please use Q&A function. If we have time after the speaker presentation, I will post a question. And the webinar is also being recorded and will be made available on ICN webpage after the session. For interpretation, we are providing an interpretation service in English, Spanish, and French. Please select your preferred language from the interpretation icon on the feature bar located below the main screen. And this webinar series will offer 1.5 ethnic continuing education credits to all attendees. So at the end of the webinar, we will provide a link to an interview, and upon completion of the survey, you will receive your certificates for the continuing education credits. In addition, we will send a follow-up email to all participants containing the survey and a link to the recording of the session. So now, without further ado, let's begin. And I would like to start by introducing our first speakers, Mr. Howard Cacton, who is the CEO of the International Council of Nurses, and he will give an opening remark of this webinar. Howard, the floor is yours. Thank you.
Hoyshan, thank you so much. Good morning, good afternoon, good evening to all of you. Absolutely delighted to have you with us for this really important webinar on primary health care. I bring greetings from the ICN president, Dr. Pamela Cipriano, and the whole of the ICN board as well, on behalf of our more than 130 national nursing associations around the world. As Hoyshan said, my name's Howard Cacton. I'm a nurse and I'm the CEO at ICN. And I would firstly like to also give a really big thanks to Dr. Madreen Shoba and our Deputy Chief Nurse, Dave Stewart, who worked incredibly hard on the primary healthcare vision discussion document that you're going to hear more about today. We have an ICN policy position statement, but the discussion document sets out in much more detail our vision for the future of primary healthcare and the centrality of nurses to that. We're really keen to hear your feedback on that document, your thoughts and your reflections as well. So do please share those thoughts with us in the coming days. Primary healthcare and the need to shift to a primary healthcare approach to many of us sounds a little bit like motherhood and apple pie, and something that we have heard spoken about for years. You'll find this very difficult to believe, I know, but I was educated as a nurse in the 1980s. And I was taught then about the importance of prevention and a public health approach to health care. But despite the years that have passed since then, and people who came before me, who were educated as nurses before me, we still today overwhelmingly have healthcare systems that are focused on sickness, on ill health, and a medical model to how we deal with health. So what's different now? Why is it now critical for us to push even harder for a primary healthcare approach? If we look around the world, we also see our health systems under huge pressure, some of them even collapsing, increasing healthcare needs, aging, super aging, as I've heard it described numerous times, particularly from colleagues in Asia. Health systems that are under economic pressure as well, and unable to afford to meet all of the current healthcare needs. So a primary healthcare approach seems to us at ICN, it's no longer just a nice to have, something that would be an ideal, something that we should strive for. It's actually going to be essential to sustaining our healthcare systems and ensuring that we can deliver healthcare to people right the way around the world. And that's what feels different right now about the importance of primary healthcare. I'm sure you've probably all heard Dr. Tedros, WHO, talk on many occasions about their big priority for universal health coverage, for ensuring that all peoples around the world have access to essential health care services. You may not have heard, but WHO also say that they think that achieving universal health care can be done, 90% of it can be done through primary health care. So primary health care, we hear described as the road to universal health coverage. And we would agree with that from ICN. But if the road to universal health coverage is primary health care, then what we also say from ICN is that road is paved every single step of the way with nurses. But what's the current reality in terms of nurses who are working outside of hospitals in community or social settings? We know that overwhelmingly our nurses are employed in hospital settings. We know that students often talk about difficulties getting placements in non-hospital settings and environments. There are struggles with having clearly defined career pathways for people who want to develop their roles outside of a hospital setting. And funding is often limited and not as much resources go into non-hospital based health care. Those are some of the challenges that we're up against. But we know from nursing and we know from ICN that it can be done. If you look at the publications ICN has put out over the last few years on topics like access to healthcare, the right to healthcare, innovations in nursing practice, they are littered with examples of advanced and specialist nursing roles that are delivering a preventative and integrated, a primary healthcare approach to healthcare. There are numerous and many right the way around the world, and they are a key solution to how we deal with increasing healthcare demands. But perhaps we don't so often see a healthcare system which has truly put primary healthcare at the centre. And I want to give you an example today of a primary healthcare system in a country that we visited as the ICN just last week. The ICN board had their meeting in Cuba. hosted by the Cuban Nursing Association, who also hosted a conference of Latin American nursing associations. And whilst we were there, we had the opportunity to visit some of their healthcare facilities. And at the heart of their healthcare system are something called, which I'm sure you will have all have heard of, polyclinics, a community-based health center that provides a wide range of services, emergency care, support for people with NCDs, vaccinations, immunization, mental health, obs and gynae, child health, health prevention, health education, supported by a multidisciplinary team of which community nurses, specialist nurses are absolutely at the heart of those teams, comprising the majority of staff, though of course working alongside other healthcare professionals. And they provide that first port of call for access to healthcare within their communities. The polyclinics are in addition to family doctors. There are family doctor clinics, and the family doctors work alongside family nurses. But through both the family doctors and the family nurses and the polyclinics, that is where overwhelmingly people access their healthcare. And I'll give you a couple of important numbers just to reinforce what the model looks like. In Cuba, the number of polyclinics is more than the number of hospitals. There are 465 polyclinics and 400 hospitals. And it's that sort of redistribution in terms of healthcare facilities which are essential to supporting a shift to a primary healthcare approach. As well as it being an ethos, a model of care and a model of practice, the infrastructure and the resources need to be in place to provide that. Here's one other fact for you from Cuba. They have a total number of 73,000 registered nurses. Out of that 73,000 registered nurses, 34,000 work outside the hospital sector, work in the family doctors, the family nurse clinics, work in the polyclinics as well. Now, if you think about your healthcare system and where you're from, overwhelmingly, we know that the numbers of nurses working outside hospitals is often quite small in comparison to the total population of nurses. In Cuba, it's about half and half. About half the nurses work in community settings, in polyclinics, and about half in hospitals as well. And this is deliberate policy supported by resources, by the political decision makers in their country. And they deliver. They were very proud to share with us how they deliver health outcomes in terms of life expectancy, in terms of child and maternal mortality rates, as good as, or sometimes better than, high-income countries who have still a very traditional medical model and are spending a lot more on their health care. So there's just one example to share with you about how health systems can change and adapt to deliver primary health care, and the fact that nurses and nursing are absolutely central to all of that. We need to invest more in nursing roles. We need to invest in career pathways. We need to invest in education. We need to invest in placements. I'm sure these are all things that you're going to touch on today, and we want to hear from you from. But final message for me: let's be in no doubt. Primary healthcare is our space as nurses, and we need to own it for the sake of the health of people right the way around the world. Thanks very much, Hoysam. Back to you.
Thank you, Howard. Thank you for the very inspiring and powerful opening remark. I echo Howard regarding the ICN publication. We do have position statements and also like the latest publications on primary healthcare. So for participants who are interested in reading more, please come to our ICN website, icn.ch. So now I will pass on to the next speakers, Dr. Madeleine Scherber. As an international healthcare consultant, Dr. Scherber provides consultancy to governments, academic institutions, and healthcare clients. She has expertise in advanced practice nursing, healthcare policy, curriculum design, and program development for nursing. In her capacity as a nurse practitioner, educator, mentor, writer, lecturer, and consultant, she advocates for insightful care to diverse population, including strategic planning for improved access to healthcare services for all. She's also the co-author of the ICN latest publications on nursing and primary healthcare towards the realizations of universal health coverage. As Dr. Scherber cannot join us today, she has prepared a video presentation. So my colleague is going to show the presentation now. Thank you.
Welcome to the ICN Nurse Policy Leaders in Primary and Preventative Healthcare webinar. My name is Madeleine Scherber. I am a nurse practitioner and also an international healthcare consultant. Next slide. I became involved in policy work as a new nurse practitioner. As a new nurse practitioner, I identified early on restrictions to my clinical practice and lack of regulatory support for optimal scope of practice. In association with my nursing organization, along with other nursing and nurse practitioner colleagues, we met with politicians and key stakeholders to take action to improve the situation and promote effective policies. Noting the significance nurses have in influencing policy decisions, I continued to influence health policy decision-making, not only domestically, but on an international level as a global healthcare consultant. What I can say to you if you are early in your career as a nurse interested in taking your first steps in policy engagement, it is very good to recognize that all too often policies that impact nurses and nursing practice are made by individuals who have limited knowledge of our practice and the importance of what nurses contribute to provision of healthcare services. Begin your health policy journey by articulating who you are, what you do, and your contribution to healthcare. Once you are confident in explaining what you do, become involved in professional as well as community organizations to promote and enhance primary healthcare and relevant policies. Next slide. I'm going to now discuss some important things to think about in the development and significance of primary healthcare. Next slide. Primary healthcare is a comprehensive approach to health that guides the delivery of healthcare services across the lifespan in all care settings. This approach prioritizes creating conditions that enhance health and well-being with a care focus on placing individuals at the center of all health service delivery, from health promotion to disease prevention. With comprehensive primary health care, there is an increased focus on care out of hospitals and out of institutional settings whenever possible. Primary health care is integral to achieving universal health coverage. Universal health coverage aims to ensure everyone has quality health services when and where they need them without any financial hardship. Universal health care includes a range of services from health promotion to treatment, rehabilitation, and palliative care. The ability to achieve universal health care will be dependent on health care based on a workforce embraces the value of primary health care and universal health care. These words are oftentimes interchanged, but there is a nuanced difference in what they mean. Primary care often viewed as first primary care, a person care professional, initial person for a concern and or makes a referral. In contrast, primary health care provides a broader, comprehensive perspective of coordinated, accessible healthcare services. Next slide. Primary health care has the potential to improve healthcare across socioeconomic levels, able to enhance people-centered care and build a more efficient healthcare system by moving away from a focus on illness and disease that emphasizes mainly variable results based on a cure approach. Nurses are often nearest to the people and understand community needs. Thus, we can contribute to shaping the goals of primary health care. The nursing workforce, registered nurses, and advanced practice nurses can promote primary health care by enhancing increased accessibility to health services, improved health promotion, improved illness prevention based on intersectoral cooperation and collaboration. Primary health care potentially improves health outcomes and health system responsiveness, moving away from fragmented and unobtainable care. Next slide. Key factors to consider when developing the primary health care workforce include availability. Are there workforce professionals that have appropriate and competent credentials, educated to provide primary health care? This will require a paradigm shift in thinking of how healthcare is provided and who provides care. With primary health care, there is hope for equitable distribution of healthcare professionals to locations where people live and require care. This requires more outreach and will be a challenge as most systems continue to be based on an illness model that requires patients to come to the healthcare provider in a primary care-based model. From the perspective of consumers and the public needs to see potential healthcare professionals as acceptable. In the primary healthcare workforce, healthcare professionals need to be able to provide care aligned to the diversity of the population. Healthcare professionals should be educated and develop a view that values primary healthcare. Again, this is lacking in many of our educational programs today. And finally, of course, we want quality healthcare professionals. And thus, the healthcare professionals must meet a professional standard supportive of primary healthcare. To achieve this requires a variety of policy initiatives. Nurses need to present active leadership in development of new proposals and supportive policies. Next slide. Traditional view of nursing needs to be expanded beyond the adjunct supportive role to be a place where they are recognized as central, vital professionals leading the charge in delivering effective comprehensive care. For example, advanced practice nurses, especially nurse practitioners, nurse-led clinics, and nurse-led services, nurse-coordinated vaccine programs, and preventative healthcare models. This will likely require increased community involvement to enhance health literacy and awareness of care options for diverse populations. Next slide. Nurse-led interventions include care coordination, such as with nurse navigators, care coordinators, case managers, and care planners to facilitate the continuity of care across healthcare specialties and sectors. Care coordinators provide an approach in which individuals experience care by an integrated multidisciplinary team. Roles outside of the healthcare system, such as nurse practitioners, are able to provide the necessary range of services from assessment of a concern to diagnosis and management of a care plan, including preventing and managing disease. And most of all, nurses are prepared and able to provide communication to assist populations as they make healthcare decisions. Next slide. Primary health care has been traditionally provided by physicians, oftentimes referred to as GPs, who deliver a broad range of services and often serve as the first point of contact to healthcare, as in the primary care model. This model is becoming increasingly challenging due to increased healthcare demands and shortages in the number of physicians selecting primary care as a career option. Advanced practice nurses, especially nurse practitioners, are educated to diagnose and treat individuals, including prescribing medications, but are educated in a different model of care from physicians based on a different focus in their education programs. The beginning focus in nursing on management is on nursing principles based on care that includes health literacy, health promotion, and disease prevention, and then the education programs progress to disease management and specialization. The concept of advanced practice nurses provides opportunities for nursing career development and increased autonomy of nursing practice. Advanced practice nurses have an essential role to play to meet the increasing demand for timely, high-quality, patient-centered care that places a value on primary health care. Next slide, please. We can talk, we can listen, but we need to also think about action. And in the ICN document, 2024 paper on primary health care, ICN provides recommendations for action. First of all, we need to implement care coordination by nurses. Many countries are beginning to do this already, but we need to do it more. We need to adopt a patient-centered approach to delivering team-based care. We need to strategically plan for the development and implementation of models that include advanced practice nurses and nurse practitioners. We need to commit to the value of increasing nurses in the primary healthcare workforce. And in order to do this, this requires education with a focus on primary healthcare, funding for this education, and establishment of a professional standard. And we need to address organizational and cultural barriers to valuing primary healthcare. The foundation of all of this is strong support for nurses to work to their full potential. Next slide, please. are discussing healthcare reform and are interested in strengthening primary healthcare in an effort to enhance universal healthcare. However, primary healthcare is still undervalued, lacking supportive policies, adequate planning, and funding. Primary healthcare is the cornerstone of a sustainable healthcare system. In today's environment, there continues to be an extensive focus on hospital-based care. For example, physicians and nurses continue to be educated in an illness model. As a result, populations requiring routine and continuous care do not receive adequate attention, resulting in delayed diagnosis, deferred, or missed care. Next slide, please. As nurses and leaders,
I think we have some issue with the video. So thank you, Dr. Sherber. And I think
transformation organized around multidisciplinary and coordinated care with a focus on health and wellness. This can be achieved through not only placing a value on primary health care, but also investing in the nursing workforce. To accomplish this, we must increase the voice of nurses in policy development and decision making. Next slide, please. More detail and a much longer discussion of this topic, I refer you to the ICN paper on nursing and primary health care towards the realization of university health coverage. Next slide. Thank you very much for your attention, and I wish you all the best for your future in primary health care.
thank you, Dr. Sherber. And thank you for the presentation about the summary of key messages from the report with the focus on nurses' role in primary healthcare. And sorry about the technical difficulties. I think we had a stop during the presentation, but it turned out to be okay. So let me proceed to the next speaker. Our next speaker is Soyeon Park. Soyeon is a fourth-year nursing student at Korea University, South Korea, and she has extensive experience in undergraduate research. Her work primarily focuses on developing self-management intervention for chronic illnesses. She is currently creating a mobile self-management program for low back pain using the biopsychosocial model, incorporating machine learning and generative AI technologies. Soyeon is also passionate about nursing policy and advocacy, and she tried to elevate the recognition of nursing in South Korea. As a student representative of the ICN Delphin Group, she contributes to modernizing the fundamental definitions of the nursing profession. So thank you, Soyeon, for joining this panel, and the floor is yours.
Thank you so much, Horshan. Hello, everyone. My name is Sun Park, and I'm currently a fourth-year nursing student at Korea University. And it is a great honor to stand here today as a representative of ICN-NSSG to share a student perspective on primary health care. In this presentation, I'd like to discuss 3 key points. First, what is the current level of student interest in PHC? And what factors influence it? And second, why is it essential for students to engage with PHC and understand its importance? And finally, how can we encourage greater student involvement in this field? So the first question is, are students interested in PHC? And I think as many of you might expect, the answer is no. From my perspective, this lack of interest is largely due to one overarching issue, which is a limited understanding of PHC. This limited understanding can be broken down into 2 key aspects, a lack of knowledge and a lack of awareness. The first, a lack of knowledge, stems from the nursing curriculum itself. At my university in Korea, PHC and the role of nurses in this field are briefly introduced in a course called Community Health Nursing. However, the time allocated to these topics is minimal and the content lacks depth. Naturally, this limited exposure prevents students from developing a solid understanding of PHC and its significance. The second aspect, a lack of awareness, is a direct consequence of this insufficient knowledge and the way clinical training is structured. For example, to graduate, I am required to complete 1,000 hours of clinical rotation, and most of these hours are spent in tertiary hospital settings such as wards, ICUs, and emergency rooms, where students witness firsthand the critical nature of acute care. In contrast, only about 150 hours are spent in primary care settings. Ultimately, this combination of limited theoretical education and inadequate clinical exposure leads to a misconception among students that PHC may not be as significant as acute care. This brings us to the second question, which is what should students understand about PHC and its importance? At its core, PHC is the foundation of universal health coverage built on the principle that everyone has the right to achieve the highest attainable level of health. With aging populations and the rising prevalence of chronic illnesses, there is a growing need to shift from disease-centered care to patient-centered care. And in the future, as current nursing students grow into experienced nurses, the demand for nursing roles in PHC will only increase, driven by the growing challenges of an aging society and chronic disease management. In this context, I believe the role of nurses as care coordinators with multidisciplinary teams becomes increasingly vital as nurses play a critical role in ensuring holistic care. Now, how can we encourage greater student involvement in PHC? I propose two key strategies. First, we need improvements in the nursing curriculum. From a student's perspective, the curriculum and clinical training serve as the main lenses through which nursing and the role of nurses are viewed. Topics that are not thoroughly covered in the curriculum may be perceived as less important regardless of their actual significance. This could lead to the mistaken belief that PHC might not be as equally important as acute care settings. By integrating PHC more deeply into lecture-based courses and clinical rotations, we can ensure students understand its critical role in healthcare. Second, we need visible role models in PHC. When students and early career nurses consider their career path, they often look to accessible role models for guidance. So having more senior nurses actively engaged in PHC and effectively promoting their work can inspire students to see how they can build a fulfilling career in this field. Highlighting these examples will help students envision their potential growth and impact as nurses in PHC. This concludes my presentation, and thank you for listening.
Thank you, Soyeon, for your presentation, and thank you for providing the student perspective on primary healthcare. And this is why we set up this webinar today, because we really want to have the different perspective from early career nurses, from student nurses, from also nurses working years in the primary healthcare settings to share their experience and to provide some insight into how we can advance primary healthcare as a profession. So now I will move on to our next speaker. So our next speaker is Dr. Sandra Davis. And Dr. Davis is the Deputy Chief Director for the Walton University College of Nursing Institute for Social Determinants of Health and Social Change. In addition, Dr. Davis chair the International Council of Nurses Education Expert Advisory Committee, where she brings her knowledge and experience to broadening the commitment to quality and equity in nursing education around the world. Dr. Davis co-authored the book Fast Facts About Diversity, Equity, and Inclusion in Nursing, Building Competency for an Anti-Racism Practice, that received a 2022 AJM Book of the Year award. She recently co-edited the book Nursing Leaders Driving Health Equity, Tackling Social and Structural Determinants of Health. So Dr. Davis is going to talk about primary healthcare, but from the nurse educator perspective. So now the floor is yours, Sandra. Thank you for joining us.
Thank you so much, Hoshan. I'm so delighted to be here with you this morning. Are you able to see the slide that I'm sharing?
Yes, all good.
Okay.
Thank you.
Okay, perfect. Yes. As Hoshin said, I am just honored and delighted to be the chair of the ICN Education Experts Advisory Expert Panel Committee. And that committee is a strategic partnership that was formed by together with ICN and the National League for Nursing to prioritize the education of nurses worldwide. Now, the aim of the ICN-EE committee is to promote the education of nurses around the world and ensure that the nursing workforce of the future is prepared to meet whatever challenges lie ahead. Now, I'd like to share a story with you that was really a defining moment for me as a nurse educator. And that really crystallized what I needed to do to help my students understand the totality of their role as primary healthcare providers. Now, I was having a conversation with a colleague, and we were talking about the document, the report, Health in All Policies. And she said, all policy is health policy. And when she said that, I realized that in nursing education, we often define the social determinants of health as the conditions in which people are born, grow, live, age, work, and play. Right? Now, although this description captures the very powerful social forces that account for about 70 to 90% of health and health outcomes, the definition is incomplete. There's a second part of that definition that often is omitted or not discussed. And the second part of the definition includes the wider set of forces and systems that shape the conditions of daily life. So, in total, right, the social determinants of health are really the social and the structural determinants of health. So, it's the conditions in which people are born, live, work, and play, and then that wider set of forces and systems shaping the conditions of daily life. And so it's important for me to really help my students in primary care link to those upstream factors, right? Link to the economic policies, the social policies, the political systems, all of those things that are really, really important. And all of those upstream factors that influence and impact the work that they do in the communities with families and with communities. So I want to emphasize that in primary health care, right, we have to really think about developing structural competency. And that is really having the ability to recognize that health and health outcomes are the downstream effects of these broader social, political, and economic structures. So understanding the totality of what we do in primary care from both a downstream perspective, but also that very important upstream perspective, because that is really what's going to lead to what we see in primary care, especially those inequities that we as nurses can transform. And we can do that by understanding the totality of what we do in primary care. That includes both the upstream factors of recognizing the economic and political influences on our practice and what we see in our communities, and then also being there, right there with our families and communities to, to promote health and well-being. So thank you very much. And I'm delighted to have this opportunity to be with you and to share that perspective in primary care.
Thank you, Sandra. Thank you for your presentation, and thank you for providing like a more in-depth perspective, like from an educator point of view, and also thank you for like capturing like the critical role of nursing education in primary healthcare. Thank you so much. And now, without further ado, I will move on to our next speakers, Dr. Karen Moore. Karen is a dual certified adult and family nurse practitioner, a certified global nurse consultant, also ICN MP and APN Network Core Steering Group Secretary, ICN Global Nursing Leadership Institute alumni, US Fulbright specialists and the coordinators of the Global and Planetary Health, DMP Director and Professor in the graduate program at the Trudy Brush Valentine School of Nursing at St. Louis University. Her practice and research interests include global health, infectious diseases, healthcare inequities, diversity, occupational and environmental health, and also low resource communities and health promotion. Dr. Moore is a fellow of the American Academy of Nursing and a fellow of the American Association of Nurse Practitioners. So we are very privileged to have you here in this panel, Karen. And now I will pass the floor to you to talk more about the role of APN in advanced practice nurses in primary healthcare. Thank you for joining us.
Thank you so much, Hoshan. Let me share my slides here real quickly. Don't be alarmed, there are a number of slides, but I speak quickly. So a couple things to really be aware of is that when we think about advanced practice nurses in primary care, it's important to note that we all start as a nurse first. So I've been a nurse for over 30 years. My nursing career was basically in oncology, acute medicine, and infectious disease, all tertiary care. Then I moved into advanced practice nursing about 25 years ago and did work in a variety of settings, including primary care. I also am in the educational sector and do some work with the ICN and with global colleagues. A way to think about primary care and the impact that APNs can have, and that you as APN students and new career people can have in APN development, is when you think about policies, it really starts with the patient. It starts with patient care. It starts with identifying issues that you see on the floor in your communities, and then that moves you to advocacy. When I first started as a nurse on the floor, some of the first HIV patients in my region were on my floor, and I began to care for them, as well as oncology patients making end-of-life decisions and ethical decisions about their care. It quickly educated me that it wasn't enough to provide good care, but you had to go a step further and really advocate for your patients and advocate for what was best for them. You also needed to really engage with the policy development, because advocacy may be just at your institution level, but frequently it goes beyond that to really looking at the people who are making the laws, making the legislation, putting the regulations in place, providing the payer source. That's all part of policy engagement. When you think about policy skills development, what it typically looks like is that, again, you identify those issues that impact patients. And then I found that you start networking with local issues or organizations. So whether it's your local APN organization, your local nursing boards, and then you broaden that out to national networking and engagement. As you get more involved, you start seeing these are commonalities within the country. It's not necessarily my locale, it's really a bigger issue. And then as I moved into collaborating with the ICN, you begin to see the connections of all the ways that issues of primary care and healthcare delivery are impactful globally. When I realized that I needed additional assistance to really refine those skills for policy engagement, I was pleased to have been selected to go to the ICN Global Nursing Leadership Institute, which was a wonderful experience in teaching us how to really engage policy and engage policymakers. I think it's important to start with what is an advanced practice nurse. Some of you may have that awareness and may have the awareness of what it is within your country, and others may not. An advanced practice nurse is, according to the ICN context put forth in 2020, it's a generalized or specialized nurse. They have to have at least a master's degree and have clinical competencies for advanced nursing practice in an expert knowledge base, complex decision-making. And the characteristics of that APN are going to be shaped by the context in which they're credentialed to practice. So it is culturally significant, meaning that APNs in one country don't look exactly like APNs in another country, but they do have a framework which ties them and unites them. The clinical nurse specialist and the nurse practitioner are the most common APN roles. The pillars of the APN role are education, much as my previous presenter spoke to, practice, a robust practice, and policy or regulation interests. When we think about the history of APNs, it's important to note it started back in the 40s, 50s, and 60s. The first nurse practitioner program was in fact developed in primary care pediatrics with the goal of extending primary healthcare services within the community to children and their families who are without care. I think that's not insignificant because of how the role developed and where we see the ability for NPs to impact and APNs to impact. You can see that it has continued to spread throughout the world with various countries coming on board, developing those throughout Europe and Asia and Africa and even the Caribbean. And I think that's important to note that it is still continuing to develop. So the APN role is not done. APN development is not done. That's something that continues to move forward. And APNs have the ability and the capabilities to impact primary health care and to provide communities with better care. The ICN network, the NP-APN network, exists in order to provide international resources for APNs and to provide information and resources for those who are interested in APN roles. So that includes policymakers, educators, regulators, and researchers. We want to make sure that we can provide timely information, a forum for sharing, which I think is really one of the big assets, is that the APN network is made up of representatives from all over the world. And we exist to support APNs who are just developing and countries who are developing the APN role. We're divided in subgroups. This is a little picture from our last conference, which was held in Aberdeen, Scotland this last year. We focus on research, education, policy initiatives, practice, and we also have a student subgroup. The members are from 141 countries, which is wonderful, and we try to balance out membership on each of the subgroups by not having more than 2 members from any one country. So that way we really do hear the voice of global colleagues. The student subgroup is open to all. It's wonderful. It allows for collaboration, gives you opportunities for abstract submission and exposure to global concepts in healthcare delivery. I know I saw some of you on the call who started in our student subgroup. I noticed some of your names, and it's good to see you again. The APNs in primary healthcare, again, it developed in primary care originally and has expanded, but in some countries, the primary care role is not as well developed because of generally payer sources. So that's a big policy issue that needs to be addressed to get full access for primary healthcare to our patients and populations. I was asked to provide a few vignettes of what APNs in primary healthcare might look like. So I selected the US and Ireland because there are some interesting initiatives and it gives you ideas about what primary care and APN's impact on primary care can look like. In the United States, we have primary and acute care NPs, we have clinical nurse specialists, certified registered nurse anesthetists, and certified nurse midwives. All have at least a master's degree, many have a doctorate. Certification is via national examination, and registration is within each state. So that means there's policy work that has to be done at each state level. There are over 385,000 nurse practitioners in the US, and 87% of those exist in primary care. So it's hugely impactful. What APNs can do in a community, it's hugely impactful. NPs are the fastest growing primary care provider in the US with nearly 1 billion patient visits annually. That's 1 billion patient visits that wouldn't be happening if it wasn't for nurse practitioners. That's huge. Prescriptive authority is available in all 50 states. These nurse practitioners do prescribe, diagnose, treat, many fully independent. And that's full independent practice. Over half of our states allow for nurse practitioners to open their own clinics, bill insurance carriers, accept payment, and provide care and admit to hospitals if that is needed. 3 out of 4 patients support increased legislation for greater access to NP care. And that's pretty significant. That's happened over just a matter of about 50 years, 50 to 60 years. In Ireland, it's a slightly different landscape. Ireland has, again, the Nursing and Midwifery Board of Ireland registers advanced practice nurses. They have a well-developed framework for registration. They have regulation that is well-developed. The educational status has to have at least a master's in nursing, in the theory portion, but the primary care piece is often held back a bit by policies and payment issues related to clinical sites. So one of the challenges is funding for APNs in primary care. There is a great need for increasing general practitioners, but to date, there are about 800 APNs with only about 20 of those in general practice. So that's important to do. Sláinte care was a healthcare policy of trying to provide the right care in the right place at the right time, which was an initiative of Ireland. And while that's made some inroads, there are still a significant shortage of GPs. The pay issues, again, have to be resolved, but that doesn't mean that one person can't make an impact. And a person I met when I spent time in Ireland, who is a wonderful nurse practitioner, her name is Karen McGowan. She leads out in the Irish Menopause Society. She's very active with women's health projects and has in fact initiated a postmenopausal bleeding clinic, which has been very successful in shortening time to care for women who are experiencing these troubling symptoms. Hugely impactful. So that's an ambulatory care type intervention, but it's really providing a primary service to patients. She's also started another project called the Ladies Lounge, which provides a safe space to discuss women's health issues. It offers educational offerings on prevention and primary care and screenings, as well as other topics of interest. And again, this is an example of how one provider can do something innovative, can collaborate with others in her sphere, can really push healthcare forward. And I think that is a good model to think about. Just because there might be few of you in your country doesn't mean you can't be terribly impactful. And as a student, when you're looking at your ability to impact, you need to start thinking in that way, right? We have the ability to provide care to patients exactly where they are. We have the ability to expand coverage and care to more individuals and community, improve the overall health of populations, and impact health outcomes through primarily improved chronic disease management. And that's really huge. That's diabetes, that's hypertension. Those are the things where we can have a great impact. And when you think about you, and personally, I like to always end with really thinking about it personally, how you can get involved is to really connect with local APN organizations. This can start even when you're a student. So think about policy issues impacting care. Think about the things you're seeing in your clinicals when you go through it. And reach out to experts in your field of interest. If there's someone on here on this session, or you read about them, or you hear about them, and you think they really have something that I could learn from, reach out to them. You know, most people are very happy to communicate with someone that they feel like is interested and is going to move the needle forward. It's important to also learn to interact with policymakers and legislators. Those are people who are making the decisions that directly impact the care of our patients through payment and through registration issues. Engage with the ICN networks. Attend conferences and educational sessions. We have the ICN Congress coming up, and it'll be in Helsinki, Finland this next summer. We have the APN conference, the next one, the last one was in Aberdeen, the next one will be in Nashville in the United States. So certainly interact in those ways. Look at local educational sessions, national educational sessions, and seek out additional training opportunities on policy and advocacy. I hope that this was helpful for you, and I really feel that you have the ability to impact care, and you have the ability, no matter where you are and whatever stage of career you're in, to move the needle forward. So thank you for the opportunity.
Thank you, Karen. Thank you for your presentation. And I think it's really, really insightful to hear more about the emergence of the advanced practice nurses and also their role in primary healthcare. And I found it very interesting that you pointed out some of the example case study about APN roles in leading primary healthcare in several countries. Thank you very much for your presentation. We are very happy to have you here. And let me move on to our next speaker. So our next speaker is Dr. Neelam Dhingra. I'm sure that most of you know Dr. Neelam, and she's a big advocate for patient safety. She has been working for WHO for over 25 years, and she is now the Vice President and the Chief Patient Safety Officer for Joint Commission International, JCI, In this role, she led JCI global efforts in providing strategic leadership on patient safety and promotes all aspects of JCI patient safety and quality improvement activities internationally. And Dr. Needham also served as the chief spokesperson on patient safety and quality topic externally at the international conferences and events, and serving as the key liaison between JCI and the patient safety community, which includes the Ministry of Health, intergovernmental organization, non-government organization, and healthcare organization and system. She guides transformation of the design of services to further enhance patient safety and quality. So it's a huge pleasure to have you here, Dr. Needham. Thank you for joining. Thank you for sharing your wisdom to nurses around the world. Here, the floor is yours.
Thank you very much indeed for giving me this opportunity, and my congratulations to ICN leadership for initiating this webinar series, which is absolutely, extremely important and very impressive. So I will just like to share my slides so that I'm keeping it to time, and thank you very much for the introduction so that it helps me to move ahead. So as Harshan mentioned that I work with WHO in the roles of heading patient safety flagship and blood safety programs. And it helps me to share with you that how I got involved in the policy work. And from WHO, when I was working in blood safety first, I realized that blood safety played a very important and essential role in prevention of HIV infection. And that's how, when the HIV program was being established in WHO, I got involved in the policy work that time. And then, having worked with for so many years, was involved in resolution for the World Health Assembly, where I was directly providing the secretarial support to member states who were negotiating these resolutions, and guiding them in terms of the processes, as well as how we could make it impactful in implementation. And in my current role in JCI, also, I'm taking forward the actions which we have defined through the World Health Assembly for blood safety and patient safety in the last 25 years of my career. Let me share with you some of the key definitions to make it easy for everyone, particularly the early career nurses, on what is patient safety and what key terms are used for patient safety. So patient safety is defined as the absence of preventable harm to a patient and reduction of risk of unnecessary harm associated with healthcare to an acceptable minimum. Because all harm may not be avoidable, but it's basically about all preventable harm. And adverse events in incident which resulted in harm to a patient, and error, as the English term, is failure to carry out a planned action as intended or application of an incorrect plan. Near miss, an incident which did not reach the patient, but it happened, but did not really reach the patient. Adverse drug events is any injury resulting from medical intervention related to a medicine, and this includes both adverse drug reactions in which no error occurred, and this is because of the inherent property of the drug, or complications resulting from medication errors. And medication errors are defined as any preventable event that may cause or lead to inappropriate medication use or a patient harm. So with those definitions, I think it will be much clearer when I'm going through the different perspectives of patient safety in primary care. So looking at the health and economic burden of unsafe care and how does it impact primary care level, in hospitals, 1 in 10 patients are harmed while receiving healthcare, which is a huge burden of harm which is happening in healthcare around the world. Patient safety is truly a global concern because it affects situations in developed countries as well as developing countries. And we all recognize that most of the care now is provided at the primary care level, but and this is really the direction in which we are going, as Howard mentioned, in our journey for universal health coverage and sustainable development goals. So when most of the care is provided in primary care, but there's a huge body of harm which is happening here. So 50% of patient harm, which burden which originates, is coming from primary ambulatory care. Safety lapses in primary care lead to more than 7 million hospital admissions per year, which could have been avoided. And if you look at the number of deaths, 3 million deaths occur due to unsafe care everywhere. globally in every year, and at least 5 people die every minute because of unsafe care. So huge burden of unsafe care and harm which is happening, and it also leads to major cost implications. 15% of total hospital expenditure is the direct result of safety failures, and a major component of diagnostic errors and medication errors, and more than $1 trillion is the cost of unsafe care globally, which are the estimates. So it's a huge challenge and burden both at health level and economic level. So what is the need for safety in primary care services? Every day, millions of people across the world use primary care services, and most of the care actually is provided in primary care in countries across the world. So there's a potential and necessity to reduce harm is very considerable at primary care level. And it's been seen as safe and good primary care may lead to fewer avoidable hospitalization. And unsafe primary care can cause avoidable illness, injury, and lead to unnecessary hospitalization, and in some cases, disability and even death. So there's a huge need to address patient safety at the primary care level, seeing the magnitude of services which are provided and the huge burden which is happening in healthcare of unsafe care. So just to share with you, in 2019, it was a watershed moment for patient safety at the global level, when the 72nd World Health Assembly adopted a resolution on global action on patient safety, asking for safety at all levels and all settings of healthcare, and physical and mental health settings as well, and also established a World Patient Safety Day to be observed every year on 17 September. In addition, asked WHO to formulate a global patient safety action plan as a roadmap for 10 years action for patient safety aligned with Sustainable Development Goals. And this particular action was taken forward by WHO over a period of 2 years from 2019 to 2021. And in 2021, the World Health Assembly adopted the first ever Global Patient Safety Action Plan, and 2021 to 2030. And this has 7 strategic objectives which relate to policy, high reliability systems, safety of clinical processes, patient engagement, health workers' education, skill and safety, information, research, and risk management, and finally, synergy, partnership, and solidarity. And I'll just touch upon 2 of these, which is strategic objective 3, as well as number 5, related to health workers. This one, strategic objective 3, which is about safety of clinical process, to assure safety of every clinical process by identifying risk-prone procedures, looking into where the risks are in use of medical devices, medicines, blood, and vaccines, also looking at special programs of medication safety and infection prevention and control. And this particular strategic objective also defines 5 strategies, and all of these are relating to safety at different levels of clinical services, particularly also at primary care and transitions of care and mental health. The one related to health worker education, skills, and safety is to inspire, educate, skill, and protect health workers so that they can contribute to the design and delivery of safe care. And this relates to identifying centers of excellence for patient safety education and training, also developing patient safety competencies and appraisal systems which are linked to the development of competencies in health workers and providing a safe working environment. So WHO reported to the World Health Assembly this year, actually in 23 and 24 as well, on how are we implementing patient safety systems interventions in primary care through a report which is Global Patient Safety Report 2024. And this report highlights that while more than 2/3 of countries have started implementing patient safety interventions in primary care, only about 17% adopted a comprehensive approach. So most of the countries actually have at least one of these interventions, whether it is patient safety reporting and learning system, or it is training, developing training and competencies, or patient family engagement initiatives, development of patient safety standards, safety culture, or patient safety surveillance. And another extremely important data which I want to share is how the patient safety topics are incorporated in professional education curricula for various health workers categories. And very reassuring actually to note that nursing education is the most progressive in incorporating patient safety principles, with 67% of countries including them in their curricula. So you can see, as compared to all the other disciplines and educational systems, nursing professionals are really covering patient safety in a very, very holistic manner, which is very reassuring. Now, a couple of thoughts I would like to share with you. What is the role of nurses in ensuring safety at the primary care level? First, most important is promoting safer practices through medication safety, for example, through accurate medication reconciliation, preventing medication errors, educating patients about proper medication use, also infection prevention through following strict hygiene protocols, educating patients on infection control and what is their role in it, and administering medications and vaccinations safely. Screening and prevention is another way of promoting safer practices, which is through routine screening for chronic conditions like diabetes or hypertension and other non-communicable diseases, and identify early warning signs of potential health issues. The next one of role of nurses in patient safety in primary care is patient education and advocacy through health literacy by educating patients about their diagnoses, treatment plans, and self-care practices, ensuring that they understand how to manage their health safely, and empowering patients and engaging with patients, advocating for patient involvement in care decisions, and also reducing, this will lead to reduction of risk related to misunderstandings or non-adherence to treatment. Effective communication and coordination is extremely important role which nurses play through interdisciplinary communication, acting as a liaison between patients, primary care providers, specialists, and community resources, and that will definitely ensure continuity of care. Safe handoff is an extremely important role, which is to provide clear and comprehensive patient updates and even use standardized tools such as situation, background assessment, and recommendations as an example. Identifying and addressing risks through early detection, through monitoring of signs of worsening conditions or complications, and allowing for timely interventions. And reporting adverse events and errors is extremely important role which nurses play through identifying adverse events and near misses and errors, and also contributing to system-wide learning and prevention strategies. And I must mention here that nurses is the most important healthcare profession in preventing harm to patients because they are directly involved in patient care. And if something has slipped through the system, has not been able to prevent, nurses are at the front line at the point of care to prevent that harm from happening. Then improving care systems such as participating in quality improvement initiatives, leading and participating in initiatives to reduce safety risks such as patient falls or errors from happening or delays in care, using technology and leveraging, for example, electronic health records to document care accurately, to track patients' progress, as well as to flag potential issues like drug interactions or any other risk environment which may lead to harm. And preventing hospitalization and readmissions is another important role through focusing on managing chronic conditions, providing post-discharge education, and also ensuring that follow-up care to prevent complications is given that could lead to hospital readmissions. Finally, supporting vulnerable populations is an extremely important role which nurses can play through addressing social determinants of health, and also making sure that there's access to resources and addressing language barriers when communicating with patients and families. I'd just like to share, in addition to the ICN excellent resources which are being developed for primary care and safety in primary care, a couple of resources which I would like to mention is the WHO technical series on safer primary care, which has different areas, four areas mainly under which there are these 9 modules, which is patients, health workers, tools and technologies and care processes, patient engagement, education training, human factors, and also electronic tools utilization, administrative errors, how to prevent these, diagnostic errors, medication errors, special care and multimorbidity at primary care level, and transitions of care. And these are just graphics of these different modules, and you can find this on WHO website, this Safer Primary Care Technical Series with its 9 technical modules related to different areas and care processes in particular. Another important resource I want to share with you, which has been developed by the Agency for Healthcare Research and Quality on patient safety and quality and evidence-based handbook for nurses, very important resource as well for building capacity on patient safety and quality. And in the end, I would like to just share with you some of the approaches which early career nurse could utilize when they are interested in policy engagement through educating yourself. So understanding the basics, looking into healthcare policies, how they are developed, nursing advocacy, nurses joining associations, and also understanding the legislative processes, staying informed through news and trends, what's happening and what are the main issues these days, getting involved locally through joining professional organizations, attending local meetings, leveraging your clinical expertise through sharing your insights into different issues, and also advocating for patients and facilitating the voice of patients through networking and building relationships, connecting with mentors and your nursing leaders and your peers as well as colleagues, and collaborating with them in a meaningful manner, engaging in advocacy activities through writing or speaking out on these issues, meeting legislators, pursuing continuing education, taking policy focus courses and attending conferences, as has been said by previous speakers as well, and starting small and staying persistent. So begin with one issue which you're very passionate about, and then you can take it forward. So please remember, policy change takes time, and celebrate small wins and keep learning. Thank you very much for this opportunity to join you today.
Thank you, Dr. Nina, for your presentation. It's short 10 minutes, but I think you covered a lot, and we learned a lot from you as well about the patient safety in the global context and how is it relevant to primary healthcare. And also, I think the most important part is that you highlighted the importance of advancing primary healthcare in relation to the development of healthcare workers, education and competency. Really, really important point. Thank you very much for your presentation and all your advice at the very end of the PowerPoint slide. I think our audience will find it very, very helpful. So now let me move on to our last speaker, Dr. Kate Stead. Kate is the co-chair for the primary care work stream of the World Rehabilitation Alliance. She is a lecturer in the Departments of Family and Community Medicine, DFCM, Tamarty Faculty of Medicine, University of Toronto, Canada. And the University of Toronto DFCM is a World Health Organization collaborating center on family medicine and primary care, for which Dr. Stead is involved in several projects through her capacity as a Global Health Fellow. And formerly, she was the inaugural faculty lead for social accountability and global health at the Sunnybrook Health Science Center site for the University of Toronto, DFCM. And her clinical work is as a rural family doctor in Ontario, Canada, within the Georgian Bay Family Health Team. So thank you so much for joining us, Kay, to provide your perspective on primary health care. The floor is yours. Thank you.
Thank you very much, Wei Shan. I will share my slides right away. All right, you can see this okay? Perfect. So
yes, all good. Thank you.
Thank you. Hi, everyone. So I want to start with a thought that I want to live in a world where all people have access to quality healthcare, where and when they need it, and without financial hardship. And in particular, I have a passion and a focus on rehabilitation needs. However, the reality is, as you might know, in many parts of the world, people do not have the healthcare they need, nor can they access it. And this is a big problem. I really feel that every healthcare practitioner can play a role in making change. And I personally believe the way to do this is many different professionals working together towards a common goal. As Wei Shan said, my name is Kate Stead, and I have been invited here today to share with you the role of rehabilitation in primary care, to introduce to you the New World Rehabilitation Alliance, and to talk about ways that you can help with making change in incorporating rehabilitation into comprehensive interprofessional primary care. Oh, my apologies, there we go. We all have patients, friends and family, loved ones, people we know who are desperately in need of rehabilitation services. And you know them. The patient who injured his back at work 8 weeks ago and is not improving. The patient with cerebral palsy needing ongoing interdisciplinary care. The adult in your practice with dual hearing and vision loss who has become socially isolated. There are also many people who might not be your patients, but you still know them. Your aunt who had a hip replacement and is learning to walk again. The child in your neighborhood whose language is not developing as expected and her parents think she might have hearing loss. Or your friend who has dementia and really struggles with getting dressed and preparing meals. The list continues. They all have something in common. They want and need to access quality rehabilitation services to allow them to live at their best. And so when I'm talking about rehabilitation, I'm really falling under the World Health Organization definition, which is a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interaction with their environment. If we want to put it more simply, rehabilitation helps people of all ages to be as independent as possible in everyday activities so they can participate in work, in school, recreational activities, and other meaningful life roles. Did you know 2.6 billion people worldwide, that's a lot, that's 1 in 3, have conditions which would benefit from rehabilitation, but in many parts of the world they don't have or they can't access those services that they need. Rehabilitation is often underdeveloped with limited availability across healthcare. Also, worldwide rehabilitation needs are now increasing at a rapid rate because of population growth, aging, and increases in non-communicable diseases. But in many countries, more than half of people lack access to those rehabilitation services they require. This is a global problem. Wherever you are, this is a problem. And so primary care, this was already very well defined earlier by Dr. Skrober, and so between primary care and primary health care. And I just wanted to particularly direct your attention to the fact that we are looking at healthcare services throughout the life course, from promotion, prevention, curative, rehabilitative, I'm highlighting it, and palliative services. And so what we do know is that the majority of rehabilitation needs can be met in primary care. And this comes into equity. Integrating and expanding rehabilitation in primary care is critical to improving equitable access to rehabilitation. And so what is being done at a global level about this? So in recognizing these problems as big unmet need for rehabilitation, in 2017, there was a call for action by the World Health Organization to strengthen rehabilitation in countries, and the Rehabilitation 2030 initiative was launched. That's this beautiful logo at the top, with the aim of strengthening health systems to meet this large unmet need for rehabilitation. And since then, WHO and their partners have been working on this. Now, last year, in May of 2023, at the World Health Assembly, there was a big moment for rehabilitation. There was a historic resolution set on strengthening rehabilitation in health systems. And this was adopted unanimously by the 194 member states who are present. And this resolution aims to scale up and integrate rehabilitation into health systems as a part of universal health coverage. Now, in the background, while the World Health Organization and its partners are developing tools and resources and working on this, they recognized that they needed a voice to advocate for this, to speak to this. And so this is where the World Rehabilitation Alliance was born, and we were launched last year in July of 2023 to do just this. So the World Health Organization is a WHO-hosted global network of stakeholders. And our mission is to advocate for the implementation of Rehabilitation 2030. The World Rehabilitation Alliance recognizes rehabilitation as an essential health service, that it is integral to achieving universal health coverage and realizing the Sustainable Development Goal 3, which is to ensure healthy lives and promote well-being for all at all ages. So to summarize, when we see this, Rehabilitation 2030 is including the work that the WHO and its partners are doing around producing evidence. So looking at the research as to why rehabilitation is important and the different facets that can be integrated into the health systems, in particular primary care. Creating capacity, so developing tools and resources to support countries in this. And then the World Rehabilitation Alliance is the voice for this. So raising awareness, creating demand, and mobilizing political will. We have 94 members to date. Actually, I think it's 96 at the moment, all focused around different areas of rehabilitation and including, most importantly to me, primary care. And so change is happening right now. There is a huge shift globally for rehabilitation. And we want to ensure that all rehabilitation providers and primary care providers are part of this movement. And so how can you make change? I have some ideas to share with you to get you started, and I'm sure that you have ones of your own. And so as Howard was saying at the very beginning, primary healthcare is the road to universal health coverage. And so therefore, within that, rehabilitation is a core component of primary health care that should not be ignored. And so therefore, it is also integral to that road to universal health coverage. And as he said, nurses are all along the way. And I absolutely agree with this. Nurses are embedded in every facet of comprehensive primary care. And I think that there are some ways that we can easily integrate rehabilitation needs. And so one is just learning how to recognize and identify when a patient actually has a rehabilitation need. Think about, practice thinking about when you have a patient in front of you, what might be lacking in terms of functioning? Is it physical movement? Is it mental functioning, vision, hearing loss? Primary care nurses or nurses within primary care are often the first healthcare providers to recognize a rehabilitation need in a patient. And early detection and awareness of a need is the very most important step at the beginning. And then, of course, if you have the skills or the knowledge necessary to help the patient in that need, you provide it, of course. And if you don't, this could be where a rehabilitation colleague might be of benefit, an advanced practice nurse in this area, a physician, etc. So the World Health Organization right now is working on developing a new resource called the Basic Package of Interventions for Rehabilitation. This is a free toolkit that's going to be coming out, hopefully, sometime in 2025. And it's perfect for us. And I say us because it's meant for primary care professionals. So for doctors and nurses to do what we just said, identify rehabilitation needs, and then give you the skills and the knowledge to easily provide low cost, but high impact and evidence-based interventions for rehabilitation. It will also serve as a guide for ministries of health in planning and budgeting for rehabilitation and primary care. Other ways that we can be involved. So start the conversation. Talk to rehabilitation providers in your area. When I say rehabilitation, I'm thinking physiotherapists, occupational therapists, speech language pathologists, all sorts. What is their role and what do they actually do with patients? See what you can learn from them and what they can learn from you, and start to build a network. Start thinking about building interprofessional models of care. Each country and profession will have different challenges, of course, whether it be geography, availability of primary care providers, availability of rehabilitation providers, funding, but we need to be creative in this because ultimately we want to make change for our patients. Patients deserve that. Other ways of starting the conversation is engaging the community, educating the public about the importance of rehabilitation and primary care. And once we have these networks and we have built these relationships collectively as a louder, stronger voice, then we can reach out to local governments, talk to your health networks, advocate to policymakers where you work to encourage and promote the allocation of funding for rehabilitation and primary care, because we know that is a part of leading towards universal health coverage. And hold them accountable to their commitment to Rehabilitation 2030 and, more importantly, their commitment to the Sustainable Development Goals. When we think about education, those of you who are involved as educators, or if you are a student and you can give feedback to your institutional education, let's start inspiring the next generation of providers. We need to start out with interprofessional models of care right at the beginning. This is the best care for patients. And how do we do this? Many ways. One thing I can do quickly, because I know we're short on time, is coordinating interprofessional education and training. So why don't we have shared clinical rotations where there are nursing students, physiotherapy students, other rehabilitation providers, students, medical students working together right at the beginning? This is something to think about. And then, the question comes to part of what we're talking about today is how do you become involved in broader policy engagement to make changes, not just in your day-to-day, like we've just spoken about, or in your local area, but even more broadly. So I'll briefly share with you my story, which everyone's gonna have a different story. So when I was a resident, which in Canada is you've become a medical doctor and you're in training to become specialized in your area. And so for me, that was family medicine. And I saw a post at the end of a university newsletter where there was an opportunity to apply for an internship at the World Health Organization. And I applied and I got in. And so I spent 8 weeks very pregnant. I'll tell you why that's important in a moment. In Geneva, Switzerland, learning all about what primary care and primary healthcare meant from a global perspective, how changes being made in policy, who's involved in all of these things and where the gaps are. And this was all new to me. This was not taught in medical school. I didn't learn this there. And my eyes were open to ways that I could make change at a higher level, or at least contribute to it. And I continued to volunteer with many different projects that would flow through our university, as we have a collaborating center, and all the way into my early career. And along the way, I found mentors. I think it's very important that you find someone who believes in things much more strongly than you do so you can latch on. One of my great mentors is Dr. Catherine Rouleau. She's the global health lead in the University of Toronto, and I have never met someone more passionate about primary care. I also happen to have a background in rehabilitation. I was a kinesiologist and a clinic director for rehabilitation clinics prior to medical school. And so I was actually approached by Dr. Rouleau when she was asked to be a co-chair for the New World Rehabilitation Alliance, and if I would take on the role with her. And so, of course, I said yes. Now, this time, although not pregnant, I had just had my second child. And so we all went to Switzerland again to get started in this new role. And what a great role to network and get to know others who have similar passions. I also realized that it does not, I know we're here talking about early career, but also it doesn't matter what phase you are in life. You can become involved and make change. In fact, you look at this picture of the steering committee for the World Rehabilitation Alliance, we are all in different walks of life. We are all in different areas of the globe. We're from all different professions working together. And you also need to know that this is a fraction of my work. My day-to-day life, most of it is spent in clinical practice as a family doctor in a rural community, working side by side with my nurse practitioner and nursing colleagues. And so I want to just end with this, that there is no specific path for everyone in this. Everyone has a different approach to becoming involved and making change. And the things that I would recommend are start the conversation. Get to know your colleagues. Think about building interprofessional models of care as you advance in your career. Then second is join country organizations, international organizations, regional organizations, and start to learn, start to volunteer, advocate to policymakers through these channels. And I should say, everyone who's on here today, you're already taking these first steps. You are here and you are learning and you are interested. And then the last part is truly you need to advocate for what you're passionate about. The part I put on the slide is what I'm passionate about. That's integrating rehabilitation in primary care, because I know that it is critical for equitable access to rehabilitation. It's going to improve patient outcomes and lead us towards universal health coverage. Thank you very much to the International Council of Nurses for inviting me today. And thank you for the changes we're going to do together. Please share my slides, please. The last page has resources. Everyone's available to use them. And this is my email address. You may email me, ask me questions, send me ideas, and share stories of successes. Thank you.
Thank you, Kate. It's a great pleasure to have you, and thank you for sharing the importance of quality rehabilitation service, and also what is being done and how, as a nurse, how we can move it forward. And particularly, I love your personal story and your personal touch to your presentation. Is great. Thank you very much. Unfortunately, we're already at the time that we're supposed to end the webinar. Unfortunately, we cannot move on to the Q&A session. I just want to say thank you for joining us today. Thank you for all the participants who posted in the Q&A session and also posted in the chat box. It's such a big success to be with you, to have your active participation, and to have your questions in the chat and in the Q&A session. So a special thanks to our incredible speakers, Howard, Madrin, Soyan, Sandra, Nina, Karen, and Kate, for sharing their expertise and insights on advancing primary care. And for the next step, as a reminder, we will share the link to the evaluation survey shortly. Please take a few moments to complete it, as your feedback is valuable and will help us improve future webinars. And completing the survey is also required to receive your EdNIC credits. And for final remark, we hope today's discussion inspired you and provided valuable knowledge to apply in your work and study. Be sure to stay connected with us through ICN website and social media for updates and future webinars. We will have more webinars like this in 2025. And thank you again for your time and engagement. And I wish you all a great day ahead or end of the day. And we look forward to seeing you at our next event. Goodbye and thank you all.